A new variant of the coronavirus is popping up in northeast states, officially known as BA.2, and it's been found in Connecticut and New York. It's called stealth Omicron because it's apparently trickier to detect, and researchers in Denmark say it's even more transmissible than regular Omicron, though the study has not been peer-reviewed. So we bring in Dr. Mike to talk about this. Hey, Dr. Mike.
Hello there, Jason. How are you, my
Great.
friend?
Good to see you. Happy Monday. I know there were a lot of people who weren't even really that concerned about Omicron, and now we've got the stealth Omicron. So cause for concern or no?
Well, it sounds worse than it is. It can be more transmissible, but for the most part, it doesn't seem to cause more severe illness. So the way to think of this, numbers are going down. It might slow that progression a little bit, but we're continuing to go down. So in words I like to say, don't worry about it.
I love it. Yeah, exactly. And also, this headline kind of flew under the radar, but the FDA granted full approval of the Moderna vaccine. So what does that mean and why is it important?
Well, it's formally approved. And one of the reasons some people don't want to get vaccinated is they said, well, we want to wait until it's formally approved, not this emergency use authorization. It is now formally approved for 18 and older folks. So if you're thinking about it, do it. Get vaccinated. I can't say how many times if you get vaccinated and you get boosted, you're going to be just fine because these variants are going to continue to pop up, Jason.
Yeah, that's right.
That's what's going to happen.
Yeah, and then, a lot of people are wondering about long-term, COVID-19 symptoms, lingering problems, maybe the way it impacts kids or adults. What can we do about that besides just sort of watching and waiting?
Well, I think that if you were in an intensive care unit setting with COVID and you were very sick, you're the folks that we have to worry and watch the most. Because in a recent study, even a year later, a large number of folks still have brain fog, fatigue, muscle weakness, all of that. So what do? Well, we need to learn more about it, but I would suggest that you do moderate exercise, you eat right, you get plenty of rest, and if you do those things, your body will get back into shape. There's a lot we don't know about this virus, but that's what you can do right now, especially if you had COVID-19.
What about like a daily vitamin, like vitamin D every day, adding to your exercise and all that stuff?
Well, I'm a big fan of vitamin D, even if you didn't have COVID. I've been preaching that for decades before this. So bottom line is that, yes, you want to make sure that you have proper nutrition. I'm a fan of eating healthy because the way that broccoli is made, it's better to eat like broccoli than to have broccoli in a pill form. So eat the broccoli.
Yeah, but you like a good pasta meal, Dr. Mike. Come on now. Sirigliano, huh?
Oh, absolutely. Yes, and look, I don't cheat on my wife with other women, but I have a steak once in a while. Yes, I do. I wear a raincoat and a hat.
Treat
I
yourself.
go to a steakhouse.
Dr. Mike?
Yes.
Love you.
Love you.
All right,
Love you.
Appreciate it.